The Vanderbilt School of Medicine First Year Curriculum Overview. Students come from all over the globe to study to become medical doctors. But what does the path to becoming a doctor at Vanderbilt School of Medicine look like? If you aren't familiar with our curriculum, it can look confusing. Luckily, we are here to help. Our unique, personalized four-year curriculum begins with Foundations of Medical Knowledge in the first year, proceeds to the Foundations of Clinical Care in the second year, and finishes with the immersion phase in years 3 and 4. This video will focus on the elements of the Foundations of Medical Knowledge, or FMK phase. The FMK phase provides a solid, broad foundation of knowledge, skills, attitudes, and behaviors needed for students to build upon as they mature into successful clinicians. Our patient-centered curriculum is designed to integrate basic, clinical, and health system science. The FMK phase features an introductory one-week course, followed by 6 foundational science courses taught over 53 weeks, plus a longitudinal course that spans the entire phase. The phase begins with the Foundations of the Profession course to help students develop an understanding of the obligations of the profession and the system in which they will work. The 6 foundational science courses range from 6 to 12 weeks in length and focus on conceptual understanding as opposed to rote memorization. The longitudinal coursework complements and builds upon the foundational science materials to help students develop their professional identity, clinical skills, and health systems knowledge. Each of the foundational science courses has consistent scheduling and assessment. As demonstrated in this example schedule, the week includes lectures, laboratories, and time for individual study. But the heart of the first-year curriculum lies in small group, case-based learning. 3 days each week in their science courses, students gather in small groups for case-based learning. The case-based approach engages students in discussion of specific disease processes that are real-world examples of possible patients. The progression through the cases simulates medical practice in a safe and supportive environment. Students also participate in a wide variety of experiential learning activities. Students work together in dissection teams in the gross anatomy laboratory to learn the details of the human body and participate in combined histology, pathology, and radiology laboratory activities related to tissues and organs taught in each of the foundational science courses. Foundations of Physician Responsibility, or FPR, is the longitudinal year-long course taken during the FMK phase. It is deeply integrated with the foundational science curriculum and designed to foster a holistic approach to the study and practice of medicine. FPR teaches elements of the 4 core responsibilities of a physician: responsibility to self and professional development, responsibility to patients and their families, responsibility to the interprofessional healthcare team, and responsibility to engage in systems and processes necessary for effective and safe healthcare delivery. Throughout FPR, students will learn important patient care skills and foster their professional identity to prepare for caring for patients and engaging in the healthcare system. During the FMK phase, students also participate in a 7-week research program called Clinical Applications of Scientific Evidence, or CASE. In CASE, Vanderbilt students learn to evaluate scientific literature critically and systematically so that they can apply evidence-based medicine to the cases they see in clinic. All courses in the first-year curriculum are graded as pass-fail in order to foster collaboration over competition. The format for first-year end-of-course assessments is the same across all foundational science courses, providing a mix of quantitative and qualitative assessments. Material from the longitudinal courses is incorporated into these assessments to allow for integrated course examinations. Qualitative assessments include competency-based assessments from peers and faculty. Development in the 6 competency domains helps students develop into holistic physicians. A unique aspect of the FMK curriculum is that these competencies are incorporated into sessions that integrate foundational science and clinical materials. At the midpoint for each course, faculty review student performance. Then at the end of the course, they review exam scores and competency assessments to form a comprehensive picture of each student's performance. Resources such as counseling or providing advice regarding study strategies and finding tutors are provided to any student who is struggling for any reason to help get them back on the trajectory to success. Each student has a portfolio coach who is an important part of their medical school journey. The portfolio coach is a trained faculty member who works with the student from matriculation through graduation to support them in developing and achieving their professional goals. As you can see, the FMK phase provides a broad foundation of the knowledge and skills needed for the medical environment. By the end of the year, students are ready to jump into their full-time clinical clerkships that will help propel them toward becoming outstanding clinical providers. This has been a Vanderbilt University School of Medicine production.